Chiropractic or physiotherapy? What's the difference? My name is Dr. Mohammed and I'm here to help you understand.
And I'm Dr. Fernando, and today we're going to be going over the methods, the myths, and the magic behind both professions. I played basketball pretty much my whole life, even at a pretty good level. I was part of the academy of a pro team back in Italy, and every now and then there would be injuries and we would have the physiotherapists that were part of the academy, and therefore, since unfortunately I had a few injuries, I just got very interested in the whole profession.
I actually broke my leg playing football. The rehab for my leg was fine, not a problem. It was after the injury. I was suffering with some back pain, but we didn't understand or know what was causing it. I then went to go and see a chiropractor, and he actually realized that it was my SI joint. So actually seeing the rehab or myself get better from something that was unrelated to my injury, that's what got me interested in chiropractic. There's a big stigma out there for chiropractors that say, oh, chiropractors just click my back and that's it. No, we do so much more. Well, I know I do. We like to do a lot of muscle work, trigger points, manual therapy, Grafton. We like to incorporate a lot of other different techniques. Manipulation is a part of it, but it's not the only thing that we do.
I think for physios that the bigger misconception is the great majority of people are just like, I'm going for a massage, pretty much, and then they just expect that it's like somewhat of a relaxing massage, not much is being done, or maybe every now and then it's just a few like machines or hot packs, these kind of things, and that's more like what the old age physio used to be, and nowadays the profession has developed so much more than you may have some massage or something similar, manual therapy techniques, then maybe there are also adjustments depending on how someone has specialized, but then a lot more like dry needling and exercise. We obviously have two different approaches no matter what, and so there I think it depends more on kind of the philosophy. So strict physio, for example, could think if I have a shoulder issue, I'm just going to treat the shoulder and maybe something that can be related to the shoulder. While instead chiro, I would say that maybe they look at things in a different way.
Yeah, so as a chiro, for example, exactly as you said, shoulder injury, if you came in to see a physio, I'm assuming they would just look at the shoulder. As a chiro, we like to look at the other areas. So for example, if somebody came to see me with a shoulder injury, they would look wrist, elbow, shoulder, neck, middle back, try and rule out all the other areas to see if it's coming from more than one area. Manual therapy, doing some sort of treatment, whether it's dry needling, whether it's Grafton, whether it's a bit of a massage. We'll combine the manual therapy with exercises, with movements at the end of the session.
I usually start with manual therapy no matter what, no matter the issue. Then depending on how the patient progresses, then we can start doing more exercises or not. But then the thing is also, many times with physio, we get people after surgeries or when they actually just have to rehabilitate. So in that case, not as much manual therapy, but definitely a lot more exercise.
I've had patients come in with lower back pain or shoulder pain. I've done a lot of the manual therapy, a lot of the treatment side of it, and then when it comes to the exercises, I'll send them over to the expert, and Fernando can help with the exercises that they can do at home, the rehab, the things that they need to do. But there are also other ways which we can cross over, and I'll let Fernando explain.
Well, the main idea is that whenever you work as a multidisciplinary clinic, you always want to have different ideas at the end of the day, because maybe someone comes to me for a low back issue and I have my opinion, I do my own test and I treat it in a certain way. However, at the end of the day, it's not necessarily about, oh, I have to be the one that fixes everything. It's more about, let's fix the patient. So obviously the patient has to be
having a second set of eyes. So another professional, whether it's a physio, osteo, whatever it is, having a second set of eyes, a second opinion is always good.
Well, let's take again the example of the shoulder. For example, there, like many times, it's possible, like with all extremities and joints, or knees or hips, feet, shoulders, most of the times maybe a physio approach is better. However, for anything that is more spine related, chiro then obviously is a lot more specific. However, obviously it depends also how
everybody has a speciality. Chiro is we actually tend to start off at the back and look at the spine as the main thing, and whether that be including the nervous system, we have a look at the resetting that. But there are so many different ways that we all treat, and that we all have different specialities in. The criticism that chiropractic gets, I think, is somewhat unfair, because it's only taking into consideration what people have seen online, and whether that be from people who are not qualified chiropractors, or people who call themselves chiropractors and because they can click somebody's back. I think actually going to somebody who's qualified and understands what chiropractic is, who is a qualified chiropractor, who knows what they're doing, looks for all the signs and symptoms for a person, and doesn't just want a quick fix, actually takes their time and gets to know somebody, does a full hour-long session with them rather than just in and out. I think that's a stigma that needs to change for chiropractic.
I wouldn't blame research in general, because thing is, of course there will be more research and more results for something that happens post-surgery, because at the end of the day people just want to see results of what happens after. So prevention is obviously very important, and I don't think it's necessarily undervalued. It's just that there will always be less interest in knowing what would happen if I were to do certain things before I get an injury. Because at the end of the day, prevention, can be done, you can kind of do it anytime, while instead injuries happen, so you have effect, and then you just look at the results after. So there is this.
So as a chiro, I get a lot of people coming in for neck pain, back, lower back, middle back, so a lot more with back pain, as well as that, because I focus on posture. A lot of people want to improve their posture, open up their shoulders, rounded shoulders, because nowadays most people are sitting at their desk. And then on the odd few occasions, get some hips, knee, lower back.
For me, I would say it's very broad. I tend to see pretty much everyone, whether it's like the usual low back pain, knee pain, shoulder pain, but then also because of the way I specialize, since I also did osteopathy, then I tend to get lots of people with, for example, migraines or tinnitus or vertigo, these kind of issues, and then also digestive issue related things. Therefore, I would say, this is kind of the people that I tend to see the most. But obviously, as our profession grows, also as our lifestyle changes, then also
the world is changing.
The world is changing, so the injuries are changing as well.
I had a patient a couple of weeks ago, to be completely honest. She'd been suffering with knee pain for years. She'd had all of her surgeries, all her operations, everything. And she'd had so many treatments on her knee, but again, nothing was helping. She came to see me, we had a look at her hips and lower back. It turned out a lot of the pain was coming from her hips. Done a lot of treatment, worked in her hips, lower back, freed up a lot of the area. Got up after the session, and for the first time in about, I'd say 3-4 years, she was saying she literally was pain-free, and this was just after one session. She got up, and she's actually, I remember this very clearly, because she got up and she jumped, and I was like a bit shocked. I was like, I was like, what? And then she just started jumping and walking on. She goes, and she was so happy, and it made me feel like I've actually been able to change somebody's life.
This person had such a bad case of vertigo that basically she couldn't really do anything. She just stayed home, avoided any kind of contact with the exterior. And I remember we started treating her, I started treating her, and then with time, because obviously won't be immediate, particularly something like vertigo, but then she had a complete 180. She went from depressed state, I don't want to see anybody, I don't want to do anything, to, oh wait, my head is not spinning anymore, nothing moves around me anymore. And that's when she started doing things all over again. She got her life back. That was probably the one I'm like, okay, I'm very proud of that one.
I think that's the most rewarding thing about a job, is actually seeing the difference in people's lives and the difference that we can make to somebody's lives. And it's not, well, I know for me anyway, it's not just about getting patients in, it's actually making an improvement in their everyday life.